Welcome back guys. Now in this video let's discuss about hearing. So we have already seen vision as a special sense. Now we are going to discuss about the next special sense, that is the hearing. Now before understanding that, you have to know the general basic anatomy of the ear. Okay, now ear is divided into three parts: the outer ear or external ear, middle ear and inner ear. So these are the three parts of ear. So how many parts are there? Outer ear, middle ear and inner ear. This outer ear is also called as external ear, which includes the pinna. Okay, here you can see the pinna, right? This ear, this thing. So this is the pinna, and see here, this is the external auditory tube or external auditory canal, in which we usually put the things like all the things which are used to take out the ear wax. Okay, so earbuds. So these earbuds, whatever you keep, so that's going to enter into this canal, which is called as the external auditory canal. So here you have the pinna and external auditory canal. Now this external auditory canal is going to end with this membrane over here. This membrane which I am showing you is called as a tympanic membrane. Okay, so tympanic membrane is separating external ear from middle ear. Okay, so here is a tympanic membrane. Okay, this is not the round window. Actually round windows will be somewhere over here. So this is a tympanic membrane. Please make a correction. It's a tympanic membrane. It's a tympanic membrane. Now after tympanic membrane, you are having an air pocket here. This is an air pocket actually. Okay, this air pocket in which malleus, incus and stapes bones. Here three bones are there. Remember, like MIS. So malleus, incus and stapes. These are the three ear ossicles, small bones which are present in this air pocket. Okay, now after this, see, this is the middle ear. So middle ear consists of malleus, incus and stapes. This is the stapes bone. Now after this, please appreciate here there is a structure which is coiled like this. So this coiled structure is called as cochlea, and back to cochlea where I am pointing, this is the vestibule. So vestibule or vestibular apparatus with cochlea. This is the cochlea, vestibular apparatus and semicircular canals. Back to it, are you able to appreciate these three circular bodies present? These are called as semicircular canals. So semicircular canals along with vestibule and cochlea are parts of internal ear. So internal ear includes vestibule, cochlea and semicircular canals, and middle ear includes this air pocket in which malleus, incus, stapes bones are there, and external ear which includes the pinna and external auditory canal. Now important point is this cochlea is the one which is involved in hearing. So the sensation, special sensation hearing is under the control of cochlea. Cochlea have receptors for the sound. Okay, we'll discuss that. But anyway, see, please appreciate, back we are having the semicircular canals. The important point about the semicircular canal is they are helping in balance. Okay, balance is also a special sense. So balance is under the control of semicircular canals, and cochlea is helping us in hearing the sound. Okay, now after this, let's discuss some important points about the ear ossicles. Guys, these ear ossicles, the reason why I kept it here, because these are the image based questions came in the recent PG exam. Okay, so they will just give you this bone and they will ask you to identify what is this bone. So you need to know the structure of these bones. Okay, so please make sure you will by heart the structure. You just make sure to have the image in your mind. Okay, so here what I want you to know is, sir, these three ear ossicles are there. Okay, well and good. Now all these three ossicles in the middle ear, they will be moving, they will be vibrating with sound. Tympanic membrane vibrates. Now the tympanic membrane is going to vibrate the malleus, incus and stapes. So malleus, incus and stapes, they are moving. So what kind of joint is present between these bones? So there should be a freely movable joint which is called as a synovial joint. So in between malleus, incus and stapes, there are synovial joints present. Okay, now which type of freely movable joint or which type of synovial joint is present between malleus and incus? See, in between malleus and incus, there is saddle type of synovial joint. Okay, saddle type of synovial joint. And between incus and stapes, so in between incus and stapes, there is ball and socket type of synovial joint. Okay, in between malleus and incus, it is saddle type of synovial joint, and in between incus and stapes, it is ball and socket type of synovial joint. How I used to remember is, let's see, first of all, let's take it as a boy and girl. Okay, now this boy and girl, now they were into a relationship. Now their relationship is not that good. Okay, so they got broken. Okay, the relationship got broke up. Okay, so because of that, see, now this girl, now she is going to relationship with the other boy. Try to remember it like this. Okay, now what happened to the first relationship? It got broke up. It's a sad relationship. So it's a saddle joint. So malleus and incus, it is saddle type of joint. Now that's the reason why now she got into relationship with the other guy. Now this is really good. It works out good. So it is ball and socket. Their relationship is like a ball and socket, fit together. Okay, so it's like a ball and socket type of synovial joint. Now in these processes, they will ask you, so which part of these ear ossicles is easy to undergo erosion, or which part of these ear ossicles will never undergo erosion. Erosion means like simply like damage. See, now there is this process called as the lenticular process. Now this lenticular process of incus, now this lenticular process will undergo easy erosion. Most common to undergo erosion is the lenticular process of incus, and never undergoes erosion is the foot plate of stapes. Now this is the stapes bone. So this area is called as the foot plate. Okay, this area is called as the foot plate of stapes. Now actually it is going to open into the oval window. It will open into the oval window. So this area will never ever undergo erosion. Okay, so these are some basic points which I want you to know. Now after this, please look at here guys. Yeah, last to undergo erosion is foot plate of stapes. Now let's see how exactly the cochlea is like present. Okay, what exactly is the structure of cochlea? Please appreciate, cochlea is like a pen. Okay, we all have pens, right? Outside the pen there is the body, okay, which is made up of plastic. Now inside it there is one more tube. Outside is one tube. Okay, outside is one tube. Inside there is also a refill. So it's like tube inside a tube. Okay, tube inside a tube. Outside what we are having? Outside we have like this. Inside we are having a refill like this. Okay, in the cross section. In cross section we can see something like that. Now in the same way, even your cochlea is like that. See, outside the bone, this is the bone. Now this bone is actually twisting. Actually the bone is twisting, or the bone is coiling outside, okay, which is called as a bony labyrinth. Now inside which there is a membrane. See this blue color membrane. Now it's like a refill. Now it is also coiling like this. Okay, outside the bone is there, and this bone is twisting into like a coil. Okay, it's twisting. So this is called as a bony labyrinth, and inside there is this membrane which is coiling, which is called as a membranous labyrinth. Okay, now if I show you the cross section of this cochlea, it will look something like this. See, here outside it's a bone. Okay, outside it's a bone. Now this is the bone. Now inside there is one more membrane. See this area which I am pointing you right now. This is the refill kind of thing. This is the inner tube. So now let me show you the cochlea in a simple way. Okay, this is a bit complicated, right? Now let's see the cochlea in a different way. Now imagine this is your middle ear. Okay, here is your middle ear. Now who is sitting in the middle ear? In the middle ear, malleus is there, incus and stapes. Malleus, incus, stapes are sitting in the middle ear. Three bones, three ear ossicles are there. Now what is the membrane which is present over here? Here you are having this tympanic membrane. Okay, tympanic membrane is going to first vibrate the malleus. Malleus will vibrate incus. Incus will vibrate stapes. Now this stapes bone, it will give the vibrations where? Okay, now let's see the simplification. Okay, simplistic view of the cochlea. See, cochlea will be something like this. Outside, okay, this is the bony tube. Outside this is the bony tube. Okay, like this. Now inside who is present? There is a membrane present. Okay, inside there is one more tube. This is the inner tube. Okay, like this. So I have just unwounded the cochlea. Okay, I have just untwisted the cochlea. I am just making the cochlea into a straight tube, something like this. Okay, now this window is called as the oval window. Okay, here is the oval window present, and what is this window? Here is the round window, oval window and round window. Now where exactly stapes opens into? See, stapes is going to open into oval window. Okay, the foot plate of stapes. Okay, the foot plate of stapes, it opens into the oval window. Now what happens? Okay, now what happens? See, first of all, let's discuss about the different parts of the cochlea. Okay, later we will see what exactly happens, but first of all, what are the parts of the cochlea? Now just looking at this, tell me how many chambers are there in the cochlea. So cochlea is mainly divided into 3 chambers. Please appreciate here, this is chamber number 1, chamber number 2 and chamber number 3. Okay, it's divided into 3 chambers. What is this chamber called as? The topmost chamber. This chamber is called as scala vestibuli. Okay, it is scala vestibuli. And the innermost chamber, like the lowermost one, it is called as scala tympani. So scala vestibuli and scala tympani. Now point is, in scala vestibuli who is present? Sir, in scala vestibuli there is perilymph present. Okay, perilymph. It is perilymph. Okay, perilymph is present. See, please appreciate the same perilymph. Okay, the same perilymph, it is going to come like this, same perilymph, it's coming, and see the same perilymph will also enter into the scala tympani. So in both scala vestibuli and scala tympani there is perilymph. Okay, so both scala vestibuli and scala tympani there is perilymph present. So please answer my question. Sir, the scala vestibuli is communicating into the scala tympani. Okay, so that's why same fluid is present. So what is this communication called as? See, there is a communication or there is a window through which both the perilymph and both the scala vestibuli and scala tympani both are communicating. So what is this area called as? This area is called as helicotrema. Okay, this area is called as helicotrema. I hope you can see it. It's just HT, like helicotrema. Helico. Okay, HELICO, helicotrema, helicotrema. Okay, now what is the innermost chamber called as? This innermost chamber is called as scala media. So who is there in the scala media? So scala media, it consists of endolymph. Okay, endolymph. This scala media consists of endolymph. Question is, from where this endolymph is coming? From where this endolymph is coming? And endolymph is rich in which ions? Okay, we'll discuss. Now, see, this is the cochlea. Now the cochlea is divided into how many chambers? 3 chambers. Now let's see these 3 chambers in this anatomical view. Okay, this is the real image, right? Now see, uppermost chamber is called as the scala vestibuli, SV. Okay, it's called as the scala vestibuli. Who is there in scala vestibuli? In scala vestibuli there is perilymph. Okay, the innermost chamber, what is this chamber? This chamber is called as the scala tympani. So who is there in the scala tympani? Perilymph, same perilymph. Now this area, this middle, this is called as the scala media. Okay, the chamber, this chamber is called as the scala media. Now this scala media, it consists of what? Now the scala media consists of endolymph. Okay, endolymph is there in the scala media. Now questions. What is a membrane? See, there is this membrane. Okay, there is this membrane which is separating scala vestibuli and scala media. Okay, there is this membrane which is separating scala vestibuli and scala media. So what is this membrane called as? Here also please concentrate. Scala vestibuli and the scala media, they are separated by this membrane. So what is this membrane called as? 𝐒𝐻𝐿's membrane. So 𝐒𝐻𝐿's membrane separates scala vestibuli and scala media. In the same way, the scala media and scala tympani, they are separated by this membrane. So this membrane which I am showing you, see, this is the membrane which is separating the scala media and scala tympani. So this membrane is called as the basilar membrane. See, it is a basilar membrane. So basilar membrane separates scala media as well as scala tympani. Okay. Now, what else you need to know? See, please appreciate in the scala media, endolymph is there. Okay. But on the basilar membrane, are you able to appreciate there is this one apparatus present? There is this one structure which is sitting on the basilar membrane. So what is the name of this apparatus called as? This is called as the organ of Corti. Okay, if at all I have to show you, see here it is present. Okay, here it is present. This is called as the organ of Corti. So organ of Corti is present where? It is present on the basilar membrane. Okay, it's present on the basilar membrane. So what it is exactly doing? See, now this organ of Corti, if you look here, there are the cells present. So these cells which are present in the organ of Corti are called as the hair cells. Okay, please appreciate these are called as the hair cells. Actually, these hair cells are arranged into two types, like two groups, outer hair cells and inner hair cells. But anyway, the point is, so these hair cells are considered as the receptors of sound. Okay, so the sound energy will be converted into the action potentials. Okay, these are the receptors. They produce the action potentials. Okay, so action potentials are going to be produced here. The sound energy will be converted into the electrical impulses or the action potentials. Those action potentials, see, they will go via the cochlear nerve. Okay, this is the cochlea, right? So this is the cochlear nerve. See, from the cochlea, there is this nerve going. So entirely it is called as a vestibulocochlear nerve, eighth cranial nerve. See, if you appreciate, see the eighth cranial nerve is going like this, okay, into the cochlea. See all this, the axons of these hair cells, they will form the cochlear nerve. Okay, anyway, so in the scala media, who is there? In the scala media, there is this organ of Corti which is sitting on the basilar membrane. It contains which cells? It contains hair cells. Okay, it contains hair cells. Now, on these hair cells, there is this dome-shaped structure present. What is the name of this dome-shaped structure? This dome-shaped structure is called as a tectorial membrane. Okay, tectorial membrane. So, whenever these hair cells vibrate, okay, whenever the hair cells move, they will move against the tectorial membrane. Okay, whenever these hair cells are moving, if at all they move, okay, why they will move, we'll discuss later. If at all they move, what happens? Now they are going to rub against the tectorial membrane. Okay, that actually causes the action potentials. Okay, we'll discuss. Now, see. Now, this endolymph, okay, here endolymph is there, right? Now, questions that will come in your exam is this endolymph is secreted by, see this endolymph is secreted by a structure called as stria vascularis, okay. See, there is this structure called as stria vascularis. This stria vascularis actually secretes the endolymph. And remember, this endolymph is rich in which ions? The endolymph which is present in scala media is rich in potassium ions. Potassium, lots and lots of potassium is there here. Okay, now comes the topic. How actually the sound waves are going to be converted into the action potentials. It's very easy. Okay, now see like this. For example, now sound is coming like this. Okay, from the source, sound is coming like this. Now these sound waves are going to enter where? Now these sound waves are entering into the external auditory canal. Now the sound waves, okay, what they will do? They will come and vibrate the tympanic membrane. So when the tympanic membrane is vibrated, now this tympanic membrane is going to vibrate the malleus. From malleus, the vibrations will come into the incus, and incus is going to vibrate the stapes. Now the stapes is going to send these vibrations, okay, sound waves into oval window, okay, into oval window. Now in the oval window, the sound waves are going. So now please concentrate here. See, now malleus vibrates, incus vibrates, stapes vibrates. Now the stapes is going to vibrate into the oval window. Now these vibrations are coming where? Into the scala vestibuli. See, vibrations are coming like this. So the vibrations are going into the perilymph. Now all these vibrations via the helicotrema, now these vibrations are going to enter into the scala tympani. Now the vibrations are there in the scala tympani. Okay, now the vibrations are present in the scala tympani. Now these vibrations start to vibrate the basilar membrane. Here is the basilar membrane, and these vibrations will start to vibrate the basilar membrane. Okay, now it will start to vibrate the basilar membrane. When the basilar membrane is vibrating, what happens? Now when the basilar membrane is vibrating, automatically the organ of Corti will also vibrate. Now the inner hair cells, they will start to rub against the tectorial membrane. Okay, the inner hair cells have the stereocilia. Okay, on the surface of this inner hair cells, there are the stereocilia present. Now the stereocilia are bent. Okay, now the stereocilia are bent against the tectorial membrane. Now whenever the stereocilia are bent, now the channels are wide open. Actually, if at all I have to show you, see, okay, see, let me show you inner hair cell. See, inner hair cells are going to have, see, the cilia which are called as the stereocilia. Okay, now in this stereocilia, say there are these channels present, openings present. Okay, now these openings are actually closed, but whenever they are bent, okay, whenever the stereocilia are rubbing against the tectorial membrane, now these openings are wide open. Now these channels are wide open. So that causes what? That causes the entry of potassium ions from the endolymph. So potassium ions which are rich in the endolymph, now they will start to enter into the inner hair cells. Now what happens when potassium enters into the cell? Now these inner hair cells, they will undergo depolarization, they will undergo activation. So activation will lead to the action potential generation. So action potentials are going to be generated in the stereocilia. Now these action potentials will be going through the cochlear nerve. Okay, these action potentials, now they will go into the cochlear nerve. Okay, so this is how the organ of Corti and the inner hair cells are activated. So now tell me, what are the receptors of sound? The receptors of sound are inner hair cells. So again, in a very simple way. Now whenever sound comes, tympanic membrane is vibrated. Now the tympanic membrane is going to vibrate the malleus, vibrates incus, vibrates stapes. Now stapes is going to give the vibrations into the oval window. Now from the oval window, the information will go to the, or not the information, vibrations. Okay, the vibrations will go into the scala vestibuli. Now in the scala vestibuli, vibrations are coming like this. Via helicotrema, the vibrations will come and vibrate the basilar membrane. On the basilar membrane, there are these inner hair cells present. Now the inner hair cells will rub against the tectorial membrane. So what happens when the inner hair cells are rubbing against the tectorial membrane? There will be entry of potassium ions from the endolymph into the inner hair cells. So inner hair cells will undergo depolarization. Okay, all these events were given here. The sound waves, vibrates basilar membrane, bends the stereocilia, potassium enters into the inner hair cells are undergoing depolarization. Okay, all these events. Now let's sum it up. What and all we have discussed, let's sum it up. Okay, here. See, receptors of hearing are what? What are the receptors of hearing? Yes, receptors of hearing are inner hair cells. We have discussed. Endolymph is secreted by a structure called as stria vascularis. Now, organ of Corti is located on which membrane? Basilar membrane. Now, endolymph is rich in which ions? Potassium ions. And depolarization of the hair cells. Okay, depolarization. So, depolarization is due to entry of potassium. Depolarization of hair cells is due to entry of potassium or influx of potassium. So, these are the inner hair cells, very, very important. Okay, in most of the body tissues, depolarization is either because of the sodium influx or calcium influx. Okay, so in most of the body tissues, sodium will cause the depolarization or the entry of calcium will cause the depolarization. But here in the ear, inner hair cells, it's the potassium influx which is responsible for the depolarization. Okay, even this we will discuss again one more place. See, potassium ion accumulation in the beta cells of pancreas. Potassium will also cause the depolarization of beta cells of pancreas. So the two places which I want you to know at least is, sir, potassium ions will cause depolarization of inner hair cells. And the same potassium ions will cause the depolarization of beta cells of pancreas, which helps in release of insulin. But all in other places, either the sodium ion influx or the calcium ion influx which is responsible for the depolarization. Okay, so now depolarization of the hair cells is dependent on potassium ions. Okay, now scala vestibuli and scala tympani. Okay, it is a scala vestibuli and scala tympani. Okay, scala vestibuli and scala tympani communicate via a structure called as helicotrema. Done. Now, when we are discussing, I have said you, in the organ of Corti, there are two types of cells present, inner hair cells and outer hair cells. Now, these outer hair cells, okay, they will produce low intensity sounds. Okay, even these outer hair cells, they will move. The movement of the outer hair cells, they will cause a sound called as, they will produce a low intensity sounds which we cannot hear. Now, these low intensity sounds which are produced due to the movement of outer hair cells are called as otoacoustic emissions. Okay, they are called as otoacoustic emissions. So, otoacoustic emissions are low intensity sounds produced by the outer hair cells in response to sound. Okay, they are all the time produced. Okay, they are all the time produced. But important point is, see, now whenever you take some whenever you take some ototoxic drug, okay, ototoxic drugs, or whenever you hear such a loud sounds, okay, imagine that there is a earthquake or some bomb blast where there is a huge sound. See, whenever you hear such a high decibels, okay, high decibel sounds, what happens? Now, you will be having hearing loss. So, the first cells that will be affected is the outer hair cells. So, in ototoxicity and noise induced hearing loss, in both these conditions, the most sensitive test is otoacoustic emissions. Why? Because in noise induced hearing loss or ototoxicity, the first cells that will be dead is this cell. Okay, the outer hair cells are going to be died. So, most sensitive test for noise induced hearing loss and ototoxicity is checking the otoacoustic emissions. And not only that, these otoacoustic emissions are also the screening test for neonatal deafness. Okay, a neonate cannot say whether he is hearing or not. Okay, if you are suspecting that this baby is having deafness, okay, this neonate is having deafness, you cannot ask the baby. Like, no, if you ask a person, he can say whether he is hearing or not, but a baby cannot say whether the baby is able to hear the sounds or not. So, the most sensitive test which is done for neonatal deafness, the screening test is otoacoustic emissions. Otoacoustic emissions are the screening test for neonatal deafness. Okay. Now, after this, let's discuss about the vestibule. Okay. Now, guys, please concentrate here. This is the cochlea. Here is the cochlea. Okay, we have discussed about the cochlea. Okay, all the three chambers of cochlea, the fluids which are present in cochlea, the receptors in the cochlea for the sound. Okay, we have discussed. Now, let's discuss. There is this one structure which is present back to the cochlea. Okay, there is this one structure which is present back to the cochlea, this box shaped structure. Now, this structure is called as a vestibule. Now, if you appreciate, in the vestibule, there are two structures present, this one and this one. Okay, this is this one structure and back to it there is one more structure. These two structures which are present, in the vestibule are called as utricle and saccule. Okay, so utricle and saccule are the structures which are present in the vestibule. Okay, this box shaped area is the vestibule. Okay, now back to the vestibule, you are having this semicircular canal. Semicircular canals are present. Okay, now in the vestibule, who are there? Utricle is there, saccule is there. Now what they are detecting? Okay, so try to write utricle something like this. Okay, why? Because utricle is detecting the linear acceleration. Which type of linear acceleration? Horizontal linear acceleration. Okay, horizontal linear acceleration. So how to understand this? You just go and sit in your car. Okay, close your eyes. Okay, close your eyes and ask your friend to take the car either forward or backward. Okay, take the car forward or take it reverse. Now even with your closed eyes, okay, even with your closed eyes, you still knows whether the car is moving forward direction or backward direction. So there is some apparatus in your body which is detecting, okay, this movement. So this is the linear acceleration, linear. So this linear acceleration, which is, for example, in this case, I am giving you the example of car, which is moving anteriorly and posteriorly, like front and back, front and back. So this type of linear acceleration is called as horizontal linear acceleration. So horizontal linear acceleration is detected by utricle. So the utricle, which is present in the vestibule, will detect the horizontal linear acceleration. But now there is one more type of linear acceleration which is called as a vertical linear acceleration. Close your eyes and just go into a lift. Okay, go into your elevator or lift. Now you just stand in the lift, and even with your closed eyes, you can still know whether the lift is moving up or down. Okay, whether it's going upward or downward, you still know it. So this is also linear acceleration. Okay, there is no angles, there is just a linear acceleration. So this linear acceleration is detected by an apparatus called as saccule. So saccule, write it like this, like a dollar symbol, Okay, up and down, up and down. So saccule is detecting the vertical linear acceleration. Utricle is detecting the horizontal linear acceleration. Okay, now, so in this utricle and saccule, there should be a receptor for this also. See, in the cochlea, what is the receptor? The receptor for sound in the cochlea is organ of Corti. In the organ of Corti, inner hair cells. Inner hair cells are the receptors. Okay, inner hair cells are the receptors in the cochlea. In the same way, here in this vestibule, utricle and saccule are there. This utricle and saccule, it contains a structure called as a macula. Okay, so this macula is the receptor of sound. Okay, macula is the macula is the receptor of linear acceleration. How many types of linear acceleration is there? Vertical linear acceleration detected by saccule, and horizontal linear acceleration detected by utricle. Completed. Now let's talk about the semicircular canals. How many types of semicircular canals are there? Sir, not how many types, how many number? Okay, there are 3 semicircular canals present. Now what is the use of the semicircular canals? Now these semicircular canals will detect the angular acceleration. Okay, body bending forward or backward, okay, sidewards. So the angular acceleration, okay, is detected by the semicircular canals. So in the semicircular canals, if you appreciate, there are these yellow color structures present. These are actually the receptors. Okay, this region is called as the ampulla. Now in the ampulla, there are the structures present which are called as cristae ampullaris. Now this cristae ampullaris which are present in the semicircular canals. Now this cristae ampullaris, it detects the angular acceleration in the body. Okay, so 2 types of accelerations are there. Angular accelerations detected by the semicircular canals, and linear accelerations which are detected by the utricle and saccule which are present in the vestibule. Okay, so with this we have discussed about the second type of special sense, that is hearing as well as balance. Hope the video is helpful. Thank you.